Lupus is one of those mysterious conditions that people often hear about but don't fully understand. And today we are going to dive deep into exactly what lupus is, why it affects people so differently, what the science says about its causes, symptoms, treatments, and most importantly, how it impacts real lives. Because this autoimmune disease has been steadily gaining attention worldwide and is one of the top searched health conditions in recent years. So what exactly is lupus? Simply put, lupus is a chronic autoimmune disease, which means that the immune system, which normally protects the body from infections and harmful invaders, gets confused and starts attacking healthy tissues by mistake. Think of it as your body's defense system turning against itself, leading to inflammation and damage across multiple organs. What makes lupus so tricky is that it doesn't look the same in every patient. Some people might have mild symptoms like fatigue and joint pain, while others might face life-threatening complications that affect the kidneys, heart, lungs, or even the brain. This wide spectrum of severity is one reason lupus has been called the great imitator, because its symptoms often mimic other diseases, making diagnosis incredibly difficult. Doctors often have to rule out multiple other conditions before settling on lupus, which can take years for some patients. Now let's break it down further. There are actually several types of lupus. The most common is systemic lupus erythematosus, or SLE, which affects multiple organs and is what most people mean when they say lupus. There's also cutaneous lupus, which is limited to the skin and causes rashes and lesions, drug-induced lupus, which happens as a reaction to certain medications and usually goes away once the drug is stopped, and neonatal lupus, which is rare and occurs in newborns when maternal antibodies affect the baby. Understanding these types is crucial because the treatment and management vary depending on which form of lupus a patient has. But what causes lupus in the first place? The truth is, scientists still don't have a single clear answer. Lupus is believed to be caused by a mix of genetic, environmental, and hormonal factors. Genetics play a role because lupus tends to run in families, suggesting that certain gene variants make some people more prone to developing it. Environmental triggers are another big factor. Things like sunlight, certain infections, stress, and even some medications have been linked to lupus flare-ups. Hormones are also involved, which may help explain why lupus disproportionately affects women, especially during their childbearing years. In fact, about 9 out of 10 people diagnosed with lupus are women, and the disease is more common among women of African American, Hispanic, Asian, and Native American descent compared to Caucasian women. This gender and ethnic difference adds another layer of complexity to understanding lupus. So what does lupus actually look like in day-to-day life? The symptoms can vary dramatically, but some of the most common include fatigue, joint pain and swelling, fever, hair loss, skin rashes, especially the classic butterfly-shaped rash across the cheeks and nose, sensitivity to sunlight, chest pain when breathing deeply, and mouth ulcers. Some patients may also experience kidney problems, seizures, memory issues, or cardiovascular disease as lupus progresses. What makes living with lupus particularly challenging is that symptoms often come and go in what doctors call flare-ups. A patient might feel relatively fine for weeks or months, only to suddenly experience a surge of painful, exhausting symptoms triggered by stress, illness, or environmental exposure. These unpredictable flares can make everyday activities like working, socializing, or even simple household chores overwhelming. Diagnosing lupus is another difficult hurdle, because lupus can look like so many other illnesses, such as rheumatoid arthritis, fibromyalgia, Lyme disease, or even simple viral infections. There isn't a single test that confirms it. Instead, doctors rely on a combination of blood tests, urine tests, physical examinations, and the patient's medical history. Common blood tests include checking for anti-nuclear antibodies, ANA, which are present in most people with lupus, though not exclusively. A complete blood count can reveal anemia, while kidney and liver function tests can show organ involvement. Sometimes, a biopsy of the skin or kidney may be needed to confirm lupus. This diagnostic uncertainty often leaves patients feeling frustrated and overlooked, which is why increased awareness is so important. Now, what about treatment? While there is currently no cure for lupus, treatments focus on managing symptoms, reducing inflammation, and preventing organ damage. The most common medications used are anti-inflammatories like NSAIDs for joint pain, anti-malarial drugs like hydroxychloroquine to reduce flares, corticosteroids to quickly control inflammation, and immunosuppressants to calm down the overactive immune system. In recent years, biologic therapies like belimumab have also been approved, offering new hope for patients who don't respond well to traditional treatments. Alongside medications, lifestyle management plays a critical role. Patients are often advised to avoid direct sun exposure, eat a balanced diet rich in anti-inflammatory foods, exercise regularly but moderately, get enough sleep, and manage stress. Emotional support and mental health care are also vital, since chronic illness can take a heavy toll on a person's psychological well-being. Another interesting layer to lupus is how it affects long-term health outcomes. Thanks to medical advances, survival rates for lupus patients have improved dramatically over the past few decades. In the 1950s, only about half of lupus patients survived 5 years after diagnosis. But today, the 5-year survival rate is over 90%. However, this doesn't mean the disease is easy to live with. Many patients face lifelong struggles with fatigue, chronic pain, and the side effects of medications, such as weight gain, osteoporosis, and increased infection risk. Lupus can also increase the risk of cardiovascular disease, which remains one of the leading causes of death in lupus patients. So while people are living longer with lupus, the quality of life still varies greatly. Awareness campaigns and patient advocacy groups have been instrumental in shining light on lupus, especially during Lupus Awareness Month each May. Celebrities like Selena Gomez, who publicly shared her own lupus journey and kidney transplant, have also helped bring attention to the condition. Stories like hers highlight not only the severity of lupus, but also the resilience of those living with it. These personal accounts make lupus more relatable to the public and encourage more research funding, which is critical because lupus is still under-researched compared to other chronic diseases. Looking toward the future, researchers are investigating new therapies, including advanced biologics and targeted treatments that could one day offer better disease control with fewer side effects. Stem cell therapy and precision medicine are also being explored as possible breakthroughs. Until then, managing lupus remains a balance between medical care, lifestyle adjustments, and community support. So when people search, "What is lupus?" they're really asking more than just for a dictionary definition. They want to know what it means for someone's body, mind, and life. Lupus is unpredictable, complicated, and often misunderstood. But with the right combination of medical treatment, awareness, and support, people with lupus can and do live fulfilling lives. The key lies in early diagnosis, consistent management, and spreading accurate information so that myths and misconceptions don't add to the challenges patients already face. If you or someone you know is living with lupus, remember you're not alone, and continued research and awareness are bringing us closer to a future where lupus is better understood, better treated, and maybe one day even cured.